I think that providers should be aware of both of those benefits, the hospice benefit as well as the palliative care benefit, and be open to having those conversations with their patients. When a patient comes onto hospice, they have medications delivered to their home, their equipment is delivered to their home, everything comes to them. They don't have to run out to appointments any longer, and it just takes the burden off of the patients and their families. So I had a patient who was in his late 20s, and he was developmentally disabled, and he had diabetes amongst many other things. And so he had been, when we received his data for how many hospitalizations he had, in 6 months he had been to the emergency room 26 times. But out of that 26 times, he was never admitted. So our nurse practitioner went out to visit him, and when she was doing her assessment, found out he was going to the hospital for chest pain. But as she dug into it, it turns out he was eating a diet of hot dogs, barbecue potato chips with hot sauce on it, and orange crush or an orange drink every night for dinner, and then a few hours later he'd have heartburn and go. But the beauty of this story is that our nurse practitioner was able to work with him and said, instead of going to the emergency room, call me. She gave him her contact information and got him a schedule for the bus route and tokens, and assigned him up for a diabetic class, so he learned what type of food he should eat or not eat. The outcome of that story was that in the 2 years that we cared for him, he went to the hospital one time, and that was because the nurse practitioner sent him to the hospital for a DVT. Other than that, he was functioning very well on his own. His medications were managed and his illnesses were managed with the support of the nurse practitioner and the social worker.